David, power outages challenging people with access to care and critical supplies. And this is what you bring?
John, I'm ready with food, water. This is like a hospital, and this is oral care.
Pathetic.
What could go wrong? Welcome to CareTalk, your medical home for incisive debate about healthcare business and policy. I'm David Williams, president of Health Business Group.
And I'm John Driscoll, the CEO of CareCentrix. David, what do you got today?
Well, John, the power went out in California, and I hear it's going to be going out pretty much
on California.
I know, John. It's going to be going out for the rest of the decade. Now, here's the thing: you're always touting care at home, blah blah blah. Guess what? You need power. I'm taking my oxygen. Guess what? Power's out. Boom. Got to rethink that, John.
David. Climate change is gonna change the way we get care everywhere.
Yeah.
It doesn't mean you stop moving care to the home. We just need to make sure that care to the home and in SNFs and in everything outside of the hospital is hardened and resilient. We just need to be prepared for it. And some communities are. If just because you're not prepared doesn't mean you should throw out the future.
John, I have one of these generators that they talk about that you should have.
What kind of generator is that?
It's a Honda, although we don't make product endorsements here. And you have to start it like this. Boom, if I had my oxygen mask, I'm like, that would be my last breath doing that. Yeah, they make good engines, John. But the thing is, I actually think that the opportunity may be in having solar power. So the Elon Musk, these power, generators you can have with solar on the house, and then you can
first
you're
against the future, and now you're for
I don't know what I'm John. He was before he was against it. Is that the expression?
The bottom line is that climate change is going to continue.
Yeah.
Warming's going to continue. Storms are going to continue. Make sure you're better prepared than Honda Man.
But home health is still going to be
care is coming to the home.
Yeah.
And we all want to be prepared, and you need to look at all the different things that could go wrong in the home. You make sure you've got access to transportation. You got to make sure you got access to communication. You've got to make sure you understand and are prepared for those power outages that our friend with the Honda is worried about it.
Fine. All right. You're a big brand guy, John. Let's get
Kawasaki
and Yamaha. They make decent stuff too.
All
right, now, John, let's talk about. Really. So now the opioid crisis, that's done, and now the lawyers are pushing money around. I heard $48 billion. That should take care of it, right?
We are still suffering through the opioid crisis.
Yeah, tell me about it.
And you're focused on the settlement. I'm focused on this entire
48 big ones, John.
Generation that's been hooked. And while we're doing the healthcare industry is doing a nice job at restricting access and changing the path of care, the way people get care, I think what we really ought to be focusing is taking some of your $48 billion and investing it in new models of care. What do you think about that?
I think there's this whole addiction industry, and I think if we just pour the money into those traditional uses, it's just going to be down the drain.
Be spinning people through treatment centers.
Yeah.
But there is a lot of interesting work done in digital and in new forms of care and in research in the brain, and I think we ought to take a big chunk of that $48 billion of change and invest it in new ideas to beat addiction, because while we are a generation that's suffering from the opioid crisis, we actually have a growing addiction problem and overuse problem that we need more solutions for, and it could actually catalyze, hopefully, solutions in that area.
All right,
so go for it.
Hopeful.
Yes.
Yeah.
So what about this notion that the Gates Foundation has decided not to invest anymore, or perhaps much at all, in Alzheimer's? You seem kind of agitated about it.
I'm agitated, John. Agitation is actually one of the signs of dementia, as is watching too much CareTalk. But the thing is, John,
yourself.
I was wondering what that guy was. But John, Bill Gates' father actually suffers from Alzheimer's, and so it's not like he's not interested in it. But this is one of those things.
Alzheimer's is going to affect many, many millions of families.
But the sad thing is we've lost at least about a decade, if not a generation, in Alzheimer's progress, because there's just been this big focus on beta amyloid as the cause of Alzheimer. Yeah, and it turns out that's a logical thing, but it doesn't. All the drugs fail based on that, so we need a new approach. And Gates wants to see that before he puts more of his money against it. I also
think you can't look for the Gates Foundation to solve every problem. There's actually a lot of really good research being done across Alzheimer's in the Alzheimer's area, across the across the entire sector of drug development. I think you're going to see some solutions in Alzheimer's because we have to deal with it. There's an entire generation that's getting sicker earlier and staying alive longer, and we can't afford not to invest in great solutions.
All right. Well, great solutions are good. I'm fine with that.
Yeah.
just not the same beta amyloid stuff.
Nope.
Okay.
Well, although we may come back to that.
All right. Okay. It's only been 20 or 30 years of going down the rat hole. So that's fine. No, we should give it a second, third, fourth, fifth, and sixth, and seventh chance.
You're right at least once.
All right.
So what about
just like one of those clocks that stopped? It's right twice a day, right?
But don't you think there's something we should be thinking about?
Okay.
With the rising cancer rates among vets coming back.
Yeah, it's very concerning.
Because adult rates of cancer are actually on decline, and yet and your cure rates are going up. But the rates of cancer in our military vets is actually pretty striking.
John, there's a heavy price that the veterans and their families pay for these endless wars that we've had, and I think that whatever your political view about it is, the healthcare cost, but also the sort of the psychological challenges from being in war, and now we're seeing
on vets and their families.
We're seeing rising rates of cancer. Not surprising. It's not the healthiest environment in terms of some of the things that people are exposed to.
Brutally. Think of all the materials that our folks are exposed to. But the number of vets actually seeking medical help has doubled from the VA system between 2000 and 2018. We really have to also think through whether we've got the infrastructure to support it. And I would also point to their families. There's a psychological toll that having a sick a partner who may be sick from a number of things they're exposed to affects. And I just really think we got to rethink and make sure, particularly not just on Veterans Day, that we remember our vets throughout the year to make sure they get the care they need.
John,
Hopefully we can agree on that.
Okay, we seem to do a good job of before they haven't fixed the VA, but at least the veterans get to board the planes early. I guess that's what we do as a country.
I think we got to do better than that.
Speaking of doing better, John, I hope you'll do better in this lightning round than last time.
I'm not going to agree with you.
John, I'm told we don't have to be scared of Ebola anymore.
Of course you should be scared of Ebola. Ebola is a dangerous communicable disease. You're talking about emerging from a part of Africa where they've got a breakdown of civil society. We're prepared to stop it. Yes, there's a vaccine, but stay scared. We need to keep investing in international public health infrastructure. Repeat that 3 times.
Stay scared 3 times. That. Indoor air pollution, John, is it a bad thing?
It's certainly not good, although you have been looking kind of peaked recently. It could have something to you, but the reality is it's really not much of a risk. You should just walk around outside a little bit more.
John, the thing is,
like maybe now.
There was a study, people had this idea that plants are good for the air, and it turns out they slowly clean the air, but it's nothing compared to just opening the window for 5 minutes.
Go outside.
Hey, John, there's this new bill in Congress. Hey, man, with a sexy name. Mitigating Emergency Drug Shortage Act.
That was slick.
Yay or nay?
Well, how can you take the opposition of being in favor of drug shortages? You may take that position, but I think as a bill, conceptually, it's a great idea. We do have some real drug shortages. We're not enforcing the supply chain. We've got the most expensive drug supply chain in the world. How can we have shortages? We should pass that bill.
We need to appoint the chief mitigator. Now, Susan Collins is actually one of the sponsors of this bill, which gives me
seems to entertain
gives me the negativity about it. I would say I'm against it.
We should pass it. So, David, what say the individual mandate that President Trump appears to be enforcing on visa applicants?
Yeah, at the border, John. So Trump, that border wall is going to be really cool, and it's going to have a thing where you have to show your health insurance card when you come across. He's for the individual mandate for immigrants. Of course, it's just a way to keep people out.
So let me just get this right.
Yeah.
He's for health insurance for illegal immigrants and legal immigrants, but not for
there's an exemption
citizens.
for Norwegians or anybody with the proper complexion.
It's a bad idea.
Well, that's it for another edition of CareTalk. Not quite as good as some of the ones that we shot at the health conference we had some friends in there, John, but it was okay. I'm David Williams, president of Health Business Group.
And I'm John Driscoll, the CEO of CareCentrix. Thanks for watching. Hey there, listeners. Want more Care Talk? There's more to be had in our other episodes, so be sure to look for those and subscribe to Care Talk on your favorite service.